Welcome to our Afluencer podcast. We're talking relief for back pain, a popular subject for almost anyone above maybe the age of 15, and some opportunities for influencers to promote a unique new product. So we've invited on Darrie Ichilov. He's the founder, inventor, chief back pain reliever, everything, our utility man here today. Darrie, welcome. Can you tell us a little bit about yourself? And before we get to Baxi in particular, your journey to this point.
Absolutely. So I'm a practicing physical therapist. I've been one for 32 years, still practicing, which is sort of different in the fact that most people don't last that long in the field of physical therapy just because it's so physically demanding. Studied New York, NYU, New York University, moved to Phoenix, Arizona about 30 plus years ago with my wife, and have opened up and been involved in a number of different clinics, which brought me to the point where I'm at right now.
Yeah, that's a great run. I'm going through physical therapy now myself with the Achilles. So it's always a second time going through it. I do notice everyone in the office, they're always, I'm at the point now, they're all, everyone's younger than me in terms of working there. And I always wondered why, because they're like the level of expertise that they have at a young age is really impressive, but I could see that just being a physical grind. They're kind of working out all day.
What makes me a little bit different is I believe in a lot more hands-on approach. A lot, and we'll get into it, but a lot of stretching, physicality, dealing with many body sizes, and for 8-9 hours a day of pushing, pulling, prodding, climbing. Yeah, there's a lot of demands on the physical therapist.
I could see it. I see it in the 2X a week that I'm in there. So let's get into Baxi. So I assume you came up with this idea at work. Kind of, you're seeing this recurring. I know I'm sure you've got the playbook then for the back pain and what you're doing, but I'd love to hear the background on how you came up with that idea for Baxi.
So 20 years ago, I sort of accidentally came up with a technique where I had patients lie down on my hand, and I started basically working my fingers into the sacroiliac. And I noticed that I could work my hand in there, and by pulling it open and releasing all the ligaments along the sacroiliac, I instantly basically relieved lower back pain. So what ended up happening is over the past 20 years, I honed the skill. I've treated thousands of people and noticed that it's an area that really is underdeveloped in the physical therapy and the medical world as far as lower back pain. Western medicine has sort of become pigeonholed in the fact that everything is so specialized and focused on one specific thing. So what happens is the layman doesn't really understand the anatomy and what's going on. So if somebody goes in and they may have a sacroiliac that's blocked or locked up, and they go in and they're telling the doctor they have lower back pain. Classic patient, they go in, they have lower back pain. The doctor does an x-ray, shows some degeneration, which everybody has, because let's face it, we all have wear and tear on our bodies, but nothing that specifically shows why they're having the lower back pain. So what ended up happening was I slowly developed that technique and got really, really good results. Fast forward to 20 years later, I'm not getting any younger. I try to develop a teaching method for this technique. What I didn't realize is the demands on the fingers. So I tried teaching a number of the clinicians in my office, and what would happen is their fingers would become bruised and they couldn't practice for 2 weeks. Because I developed it over a period of time, I developed calluses and basically, I don't even know how to put it, developed a way of doing it that allows me to be able to do it as many times as I need to every day. 2 years ago, what ended up happening was with COVID and everything else, I realized that, you know what, I need to take this technique to the next level. And that's where I met with an engineer here in Phoenix, and we started to develop the Baxsi Protocol. Tried it out, tested it out, have been using it in my clinic ever since with remarkable results. February of last year, decided, okay, we're now going to launch it and take it to the next level.
It's awesome. That's exciting. Yeah. So getting to the root of the back pain again, Darrie, is it the ligaments then essentially being stuck and needing to be released?
How technical do you want me to get? Keep it as simple as possible.
We'll keep it simple, layman technical, right? Someone with back pain, I know what a muscle is, I know what a ligament, I know what a tendon is, but maybe not too much more detail beyond that.
Okay, so to put it in its simplest terms, the sacroiliac is a joint, but it's not a true moving joint, articulating joint like an elbow, like a shoulder, that has cartilage protection. It only moves 2 to 4 millimeters, which is almost negligible. So what ends up happening is because of that lack of motion, not a lot of cartilage, there's not a lot of protection. What ends up happening is our body was not intended for walking on concrete, not intended for the abuse we put it through on a daily basis, stairs, twisting, turning. So what happens is that area goes through tremendous wear and tear, and every once in a while, it'll catch. What happens is when it locks up, the largest muscles in your body are in your legs, your quadriceps, your hamstrings, your glutes. And what happens is they're primarily focused on motion, on movement. When the sacroiliac locks up, what ends up happening is the force that they generate for motion starts to bleed up into the back, and it creates conflict. The back is about stabilization. So you're creating a tug of war in your spine. That's why so many people use the term, I feel so much pressure in my back. So what the Baxsi does is it basically goes in and unlocks the sacroiliac. There's no muscles that go over the sacroiliac. You can basically feel it. There are only ligaments and fascia that go over it, but all these muscles insert and attach to that fascia over the sacroiliac.
Interesting. So is that instant type of relief then after you release, or is it one of those like you release it and there's relief and then the ligaments might bunch up, so you're doing it over a period of time, but it feels like the type of thing where you're getting pretty early relief. Is that fair to say?
Immediate.
Yeah. Okay.
Immediate. You notice a difference right away. Now, you say you're in physical therapy, so you know what PT stands for, physical torture. A lot of what physical therapists have to do is we have to push patients through a pain threshold. If we didn't need to, you could do everything at home. You wouldn't require a physical therapist. So what happens is the Baxi initially has to work through a tender area. It's locked up. So it's a little uncomfortable. There's a burning involved. But as you keep using it, it sort of gets used to that. It's almost like when you have that shoulder pain that everybody knows about, and everybody talks about a tennis ball or the corner of a chair or something and pushes into that spot because it feels good. It's that kind of pain.
Yeah, I gotcha. Right. You know, it's effective, right? It hurts so good, kind of where you know it's releasing, but you got to do that trigger point. I don't know if that's the right term.
Yeah, no, that's okay. A good way to describe it.
Okay, gotcha. What are we talking about in terms of usage? Is it like a 5-10 minute thing every day? What's the Baxsi protocol?
3 to 5 minutes.
Okay. 3 to 5 minutes only. Yeah, okay.
3 to 5 minutes. Yeah. Basically, there are 4 positions. The website explains everything. There's 4 positions. The first 3 positions are about basically pushing your pelvis onto the device. Position 4 is where you roll your leg slowly out, and that gives it the pulling action, which actually pries open the sacroiliac. But 3 to 5 minutes every day. Eventually, you can use it 30 seconds, a minute. But for protocol standards, to start off with, to acclimate your body, we say 3 to 5 minutes every day.
Yeah. Okay. Gotcha. Yeah, like you're saying, I have friends with back pain and they went to the usual doctors, and that's usually not much of a help. I'm sure you know the usual prescriptions. You get the muscle relaxers, you get this, you get stuff that'll give you short-term relief, but it doesn't, I don't think, get to the core problem, which is what the Baxi seems to address, is that you need these ligaments released, right? You got to break the stuff up, let the fascia, let it all move.
Opening up the sacroiliac, exactly.
Yeah, gotcha.
Going back to what you asked me earlier, one of the main issues is we're so focused on instant relief, instant gratification, and that focuses on, as you mentioned, the pain. And we wonder why we have such a large epidemic of pain pills. Well, if you're just treating the symptoms and not getting to the root cause of the problem, what happens when you come down off of that first pill? The pain's still there. So you pop a second pill and then a third pill. And before you know it, you're addicted to it. So things like the Baxi, devices that get to the root cause of the problem, are the future of fixing this epidemic that's going on.
Yeah, that makes sense. I mean, a pain pill that's what it's going to do. An opioid is going to take away the pain. It gives you a little bit of a buzz. I never cared for them too much after my most recent surgery. I kind of got off them in a day. Just didn't want to go there with the addiction, like you said. And there's a time and a place maybe for the acute pain, but if you're not solving the problem, I don't know, it just, from a motivational standpoint. I'd rather just fix the back, right?
Right.
Like you're doing. So on the, you have the product. I remember you.
Yes, absolutely.
Next, yeah. Can we see it? Let's take a look.
So this is the Baxi.
Yeah.
And if you take a look,
Yep.
the shape, it mimics basically the technique that I use with my hand. That's the whole design. It comes with two heads. There's a blue head, which is firm, and then the green head, which is a little bit softer. I recommend using the green head first. And the reason is your body's getting used to it. I personally use the blue head. It just gets down, more action, deeper, get it over with.
More intense, higher intensity on the
Correct.
Blue.
But
Yeah, gotcha. Yeah.
People have different pain threshold. Yep. So what ends up happening is it's whichever one works for you.
Yeah, that's great. So let's talk self-diagnosis then. Let's say I got a back tweak, or I got some back pain, or I got some back tightness. What sort of steps would I go through to self-diagnose and see if, hey, might be the ligaments are tight, Baxi might be able to benefit me? What are the steps that I guess I would take as an individual to say, I don't actually want to go to my regular doctor. I'd rather, get a Baxi. I'd rather see if I can work this out. So
I always recommend, if you're not sure, just because the layman doesn't know, always seek out medical attention. That's. But as far as using the Baxi, try the Baxi first. It's not going to hurt you. You can always use it first. As far as whether it'll help or not help, it pretty much will alleviate a lot of the pressure regardless. It doesn't make a difference. For any pain that lasts severe over 3 days, I suggest at that point, seek medical attention. But there's no reason why you can't use it right away and see if it will at least release the pressure and take that pain that you're having, that intense pain, away.
Right, with that instant release element. And I think we've all, or many of us have had that, like you described with the knot in the shoulder, right? It's a matter of finding that, and just if you can release sometimes it's a muscle, right? If it's in the shoulder, it could be a ligament, right? But you got to break it up, and it hurts, like you said, when you break the stuff up, but there is that tremendous relief afterwards. So let's talk about the marketing of the product. All right, so where is it at today in terms of your go-to-market strategy? Are you working with other PTs to get this out there? What have you found to be most effective in terms of getting the Baxi in front of the people who potentially need it? So primarily, I've been marketing it through my clinic with patients. And that's great because you got it there, right? So you can show it to them and they know, right? They can, take it home almost, right? We've used a local influencer here who's had some success getting the word out there. We've gone to expos. We've gone to a number of different shows. The problem is we're a small business, local business. So we don't have the manpower, the capability. The thing with this is the market is huge. To give you an example, the beginning of the year, 2024, 2023, a study came out from Sydney University. They're predicting by 2050, there are going to be 850 million worldwide sufferers of lower back pain that they know of. That's what they know of. And the World Health Organization has already said it's one of the biggest epidemics out there, and that they've got to come up with different treatment techniques. Medication's not working, obviously, because the numbers keep increasing. So the key is getting this out there, letting people know that that there is this product out there. That's the goal here. So it makes sense. And from a cost standpoint, I assume if you think about the alternative methods, right? Even if you're going to get a deep tissue massage, these days, I'm in California. That'll run $90 just to get broken up. I know the PT sessions, it depends on your insurance. Where I am, I think the list price, they're about $200 per session, which sure, it's a good investment if that's what it takes to take away the pain, but having the Baxi that you can go to anytime, it's kind of a no-brainer self-care tool, right, if you will. Right. No, so my goal when I developed it was I felt that the $100 was the break point. I wanted to get it into as many people's hands as possible, and I figured $100, keeping it under $100 would make it monetarily acceptable to anyone who needed it.
I know myself, I'm a back pain sufferer. I know that the few times when I've had that severe back pain, I would have spent a fortune if somebody would have been able to remove that back pain at that point. So I figure $100 is a pretty good price point that somebody would spend in order to get rid of back pain.
Yeah, that's a great price point. I mean, the back pain is just debilitating because it's not only the back, it's like you can't walk, it's just, you're toast, right? When it locks up, you're in a world of hurt. 100 though is still enough for it to be attractive from an influencer partnership standpoint. So let's talk about that then. If we've got, I assume we're looking at health, fitness, wellness type influencers.
So actually you bring up a really good point. From this standpoint, as far as back pain goes, if you think of the numerous people who suffer from back pain, there's a lot of different markets that you can go to. One of the areas that I've been looking at lately, and it's been very effective in, is, for example, pregnant women. Pregnant women can't take medications for obvious reasons. And the Baxi has been really successful at alleviating lower back pain. There's very few devices. So there's that market. There's obviously, the market of the average person who sedentary, sitting at a desk job all day, 8 hours, doesn't get out, doesn't do anything. So there's that market. There's the athlete who goes and plays best. There's no limit to the different markets. Yeah,
that's why it makes perfect sense. Yeah, I would assume on the back pain on pregnancy, I mean, that would be almost 100% of the time, right? Where I know in my experience, not just secondhand through my wife, but I mean, that's certainly through both pregnancies. I mean, that's you have a human being here. Right. So that's not ideal for your lower back. So you mentioned, so the parenting influencers make sense. Anyone who gets to be my age and still tries to play a sport like basketball, and then we get hurt and backs lock up and that type of thing. So from a compensation standpoint then, Darrie, are we doing a commission on the Baxi sold for the influencer? Okay.
Correct. Yeah, no, that's exactly right. What we're going to do is create codes for any influencer that wants to work with us. And that way, then when the product's purchased, we'll know exactly who the influencer was who sold the device, and they'll get a percentage of the sale.
That's great. That's a great opportunity. And we'll get the link to your collab below the video so influencers can apply and keep it obviously nice and wide. I mean, I don't know anyone who hasn't had back pain at some point, right? And then like you said, to get relief, potential relief, something you can do that has no downside, right? Is just gonna, if nothing else, kind of free up your ligaments in your lower back for $100. And then you have it on hand, you can stash it in your basement and you've got it ready. It's kind of a no-brainer from the self-care standpoint. But of course, people usually only buy when they need something, but that's pretty compelling then. There's always someone who's having a back pain at any given moment. I know if I survey a room of friends, there's more than one hand's gonna go up.
Yes, absolutely. Somebody knows somebody who's got lower back pain at any point in time.
Yeah, makes sense. Yeah. Well, thank you for creating the product, Darrie. It seems very timely, helpful, a must-have, and to be able to scale your, the claws that you've developed, the magic claws over all the years is great. Be able to have as a self-care. I've got the what is this thing?
The back knobber.
The Theracane. Yeah, the Theracane. So my kids like to come over and hook with this. But yeah, I'd love to have the Baxi right next to the Theracane, all the self-care must-haves. Well, thanks so much for joining us, Darrie. Is there any, can you let us know where people can find you on social media, online, all that good stuff? Find more about the Baxi?
So it's www.baxi.com. That's the website. As far as social media goes, really, we haven't made a big push yet into social media. It's an area we're looking to get into from a marketing standpoint. That's basically it. As far as getting in touch with us, the focus has been lower back pain. Allow me to change the side for sort of sidebar for a second. In the marketing and in everything that's happened over the past year, it actually has become, and I know this sounds a little bit, a performance enhancer. Now, performance enhancing has got a negative connotation. But for example, I went to a large golf store where they test out products and golf clubs. And what ended up happening was I was using it there on a number of the golf pros who were practicing. And what ended up happening was after they used the Baxi, for example, one person had shot 57 drives and was averaging 260 to 270 yards. After they used the Baxi, they were able to drive over 300 yards.
Wow. Just more torque, being able to get back.
Well,
more range of motion.
Not so much the torque, the mobility, the flexibility. They were able to generate more force. I had young athletes, soccer players, who, for example, I had this one gentleman who was 5'7". We had 8-foot ceilings in the clinic, and we did a standing jump. He wasn't able to reach the ceiling. He was about 5-6 inches too short. We used the Baxi, and he was able to increase his vertical by 6 inches. Man. So that's a whole other side that we really haven't gotten into or delved into, where imagine if an athlete who thinks he's performing at 100%, just because he's not having lower back pain doesn't mean his sacroiliac isn't locked up. And he can benefit from using this device by increasing his output. So that's another whole area that we're looking into as well.
Yeah, that's really interesting. That's a good point. I heard that sort of, it reminds me of something I heard with your VO2. Everyone thinks, oh, you got to train harder, but if your lungs, if your diaphragm's locked up, an easy way to get more VO2, unlock the diaphragm, right? So this is kind of like what you're talking about, where if you're
exactly right.
Right, if you're, even like you said, even if there's no pain, but it could be stopping you on a.
Oh, absolutely, because you're still walking on stairs, you're still walking on concrete every day, you're doing all those things. Just because you don't have the lower back pain doesn't mean that your sacroiliac isn't having an effect on you. A quick way to tell is just stand in front of the mirror. Take a look, basically close your eyes, shake yourself, get comfortable, and take a look at your shoulder heights. What ends up happening is you'll notice you favor one side more than the other side. What that could potentially mean is that the side that you're leaning towards is your body accommodating the fact that the opposite side is locked up. People don't even realize. It's one of the first things I do when I see patients in the clinic is I watch them walking and I notice right away that their shoulders are uneven. Another one is when you walk. Do you notice that once in a while you lose your balance to one side over the other side? What it implies is you're putting a little more weight on one side more than the other side. There's a lot of little nuances that you can really use to help yourself. So the market is huge.
See, this is a social media goldmine, what you just told me here. We got to get you doing the shorts on the Baxi social media handle. That's great. It's amazing how it can go all the way up the chain to your shoulders from your lower back. If you've got it's just the foundation, right?
That's exactly it. Think about it this way. If the foundation of a house isn't level, it isn't straight, your house isn't going to be straight. It's going to have an effect on it. So what ends up happening is I'm a big believer, the way I learn physical therapy, the way I practice physical therapy, ground force up, because everything is going to change. Why? Because your eyes want to always remain parallel to the horizon. It's about survival. It's about tracking. It's about hunting. It's about all these things. So in order to do that, if one thing is off, everything else is going to adapt itself in order to achieve that, because that's the ultimate goal. It's about survival.
That's interesting. Yeah, that's what we were adapted, I guess, to do, right?
Yeah, it's the body modifies, right?
Yeah.
And the problem today is, instead of listening, pain is your body's voice telling you there's a problem, and all we're trying to do is shut it up.
Right. That's right. Yeah, that's right. That's right. Knock it down. Yeah. Instead of addressing, right? Like you said.
Right. That's exactly it. Why? Yeah. Because insurance companies and everything, without digressing too far, they're in the business of limiting, doing things as quickly as possible. Fixing takes time. You've got to figure out what the problem is.
This is great. I could keep you all day, Darrie, and talk to you. But we'll give the Baxi the final plug here and encourage all our influencer listeners, especially, to apply, check out the products, apply to be a partner of yours. This is great for a collab, and this is a goldmine of potential content also between what a creator could create and perhaps hash up with you to promote the Baxi. This is awesome. It's like a PT office in your living room here.
Thank you.
All right. Darrie Ichilov with Baxi. Darrie, thanks again for joining us. Really interesting conversation, product, way to relieve back pain. Appreciate it.
Thank you.